Hi, welcome everyone. We're going to give folks a second to get connected to their Zooms here. Good afternoon or good morning, depending on where you're based. I'm Michaela, an outreach coordinator here at the Pulitzer Center. If you haven't joined us before, the Pulitzer Center is a nonprofit journalism and education organization dedicated to raising awareness of underreported global issues. Our mission is to champion the power of stories to make complex issues relevant and inspire action. Last year, we supported around 300 reporting projects in collaboration with journalists, filmmakers, and news outlets around the world. We also worked with classrooms and communities to extend the impact of the journalism and cultivate public engagement with these issues globally. If you're interested in learning a little bit more about our work, I'm going to share a link to our last annual report in the chat. This webinar is the second in a two-part series with grantees Justin Maxon and Judith Surber following their exhibition at Photoville in New York City. Last week, Brian Frank and Jackie Bates joined them to discuss collaborative, responsive, and consent-based visual storytelling. If you're curious in listening to that conversation, I'm going to share the recording in the chat as well. And then just a few logistics before we begin our conversation. You'll see a Q&A icon on your screen. You can begin adding your questions for our speakers at any time throughout the opening discussion. There's also a chat icon on your screen. We'd appreciate if you use the chat box for any specific tech issues. Live transcription is available to be turned on with the captions at the bottom of your screen, and we wanted to let you know that we are recording this session and we'll post it online afterwards. So thanks again for joining us for this webinar on reframing media narratives of addiction. I'm excited to introduce our panelists for today's conversation. Justin Maxon is an award-winning photographer, educator, and socially engaged artist. He is an MFA in social practice and teaches in the art department at Cal Poly Humboldt. He collaborates with communities connected to his own positionality and history, making design and ideation decisions with participants. His work often attempts to deconstruct and provide relational alternatives to social constructs that has historically divided populations by race and class. Judith Surber is an author, mother, and grandmother, and a Hoopa tribal member. She's worked for the Hoopa Valley tribe for the past 30 years in many different capacities, most recently as a grant writer and as the manager for the medication-assisted treatment program. She is the author of both Reservation High, a fiction book about Native life on the reservation, substance use and recovery, and The Broken Ones, a fiction book that explores Native life and trauma. Jacqueline Bates is the photography director of opinion at the New York Times. In this role, she worked with Justin and Judy on their Pulitzer-supported project, Youth, Fentanyl, and Recovery. She was the founding photography director at the California Sunday magazine. And finally, Alexandra Sifferlin is the health and science editor at the New York Times opinion desk. Before that, she was a staff writer at Time magazine. So thank you again for joining us today. Thank you to all of our panelists for taking the time in your busy schedules. We're going to jump right into our conversation, but please feel free to start submitting questions as they come up for you in that Q&A box, and we will incorporate them into our discussion. So to start us off, we want to kind of dive into this project, which I'll also share a link to in the chat as well. And Judy is going to talk us through a few images from the project to help set the scene. But before we do that, Justin, could you give us just a little bit of background on this project and how the collaboration came to be between you two?
Yeah, welcome everyone. So Judy and I have been in close relationship for nearly a decade. I grew up in Hoopa. Judy is like a second mother to me. And over the many years of our relationship, we would just have conversations, and Judy would talk to me about the different obstacles that she was facing around dealing with issues around substance abuse in her family, and then her granddaughter of 13 was dealing with some substance abuse, and she couldn't find care. So there was this like really emergent need. It was like an emergent need to get the story out there because we felt like this was one of many cases. There wasn't enough care facilities in California for Native youth. And so that is how it began, is that we pitched Jackie a story that was focusing on failures in care from a rural Indigenous context in treating fentanyl, specifically looking at the issue of youth treatment. And then the project sort of developed and emerged from that, and we kind of moved away from the youth angle because we felt like it was potentially harmful to Judy's granddaughter. And yeah, we worked on the story for almost a year, um, working closely. I would spend the night at Judy's house. Just we talked through everything, had clear communication throughout the process and what images we wanted to use. So yeah, that's how it emerged.
Great, thanks for giving us a little bit of that context. Judy, can you introduce us to your family a little bit through these photos and share what was happening in that moment that relates to our larger story here?
So this picture is of me and two of my grandchildren. Kinsinta is the little girl in the front. Kinsinta means sugar or sweet in Hoopa, and I actually named her. And then the little boy in the back is little Roger. He just turned 10 this summer, and Kinsinta turned 7. So in these pictures, they are 6 and 9. This is one of the visits. My grandkids have been put in permanent foster care now, and it's been like extremely heartbreaking for me and my family. And I've been fighting every day to get them home. So this is one of the trips. Justin went with me multiple times and filmed our visits. And so this is one of our trips. We're at the ocean at Smith River.
I didn't mean to
This
click ahead there.
That's fine. This is my son Roger, Ethel, it's the kids' mother, his significant other, and the 3 kids who have been taken. So again, there's little Roger, Kinsinta, and Keishan. Keishan means summer in Yurok. So that's the first visit. This is in March, March 20th. It was Kinsinta's birthday, and it's the first time in 3 months that they got to see their parents. So it was a really emotional day. Happy, but kids crying a lot. It was just, Justin got to get pictures that day, and there was some really fun and good things, but it was really emotional. The kids had been really lonesome, and so there was like a lot of ups and downs all day. This is my son Corey, his room. Yeah, we got all his trophies. So Corey is my son who's 33. He is now for the last almost 2 years been living homeless in the Tenderloin in San Francisco. He has severe fentanyl addiction. When my son was younger, we did a lot of motocross. He had raced all over California, Washington, Oregon, had competed at Washougal and the finals for Loretta Lynn. He was a very athletic, like he was 5th grade playing 8th grade ball and would go out and shoot 48 points a game. Football, every touchdown was his. Just this really athletic kid that everybody thought would go all the way, especially with his motocross racing. And now his whole life consists of being homeless and trying to panhandle and get money every day for his addiction. This is the picture.
I think we are having some connection issues with Judy. Is anyone else having that on their ends? Okay, well, we'll give it a second
The-
here, see if she can get connected.
Trinity River.
Okay, I think while we're trying to shoot this a tad, I think let's just keep chatting for a second here. Justin, do you mind jumping in for a second and just sending
Yeah, of course.
these last photos?
Yeah, go back to the other one.
Yeah, sorry.
So on the left, that's Judy's daughter, Megan, and it's like her best friend, and they're just really, really close. And yeah, Megan is doing her hair. Like when we had the exhibition for Photoville, Megan came out, flew out with Judy, and this is the first time that Judy had ever been to New York City, and it was just amazing. They, went around. They went to the Empire State Building. They were just really just a beautiful experience for them. The image on the right, Judy's basically taking care of 3 generations of people in her home. Her mother lives with her in her room. She takes care of her mother. Takes care of her kids. Roger Roger lives in the home now currently, and then also her grandchildren. And so she's responsible for 3 generations of folks in her home.
And I remember being struck at Photoville when you mentioned that you approached some of these photos, imagining it almost as a family photo album and really trying to capture some of that relationship between them.
Yeah, exactly. I mean, my approach is that I wanted to contribute to their family album as if I was contributing to their family album. So just being present, photographing them, their daily life, their everyday moments, like, brushing the hair, watering the garden, drinking coffee in the morning, which I think is an important part of reframing the issue around substance abuse. I know that we'll get into that later.
Am I back on now?
Okay, awesome.
Okay, I tried on the phone. It won't even come up on the phone. So,
Well, we have you for now, so hopefully that is
okay.
Do you want to talk about
So
the other images a little more, or the ones that I?
Oh, you did great. You
Okay.
got it. This is Roger and Ethel and the kids, along with Ethel's 2 older children. They've been placed in a boys' home in Eureka, so the whole family has been split up. They're in a youth foster home. The other kids are all in permanent foster, and then here's the 2 parents. So this was my mom's 87th birthday, and somehow we got approvals to get everybody in together for one day. It was really wonderful, and this is the family right here. So there's Kinnick is the oldest, Keget is next, little Roger, Kinsenta, and Keishan, and then Roger and Ethel, the parents. This was the Sovereign Day. So the tribe in August has its yearly Sovereign Day. It's like our Independence Day for the tribe. This was, I believe, August 10th. And usually I'm at the fireworks with all the kids in my family. And this year I just didn't have nobody. And I didn't even know this picture was taken, but Justin got this one in. So that's the kids, Kensington and Keishan. They are across the street at the neighbors at their foster home, playing in a little sandbox. And the other one is of me. I'm on the phone at my office, looking out the window, talking.
And I know I mentioned slightly, but can you tell us a little bit about the work that you're doing right now?
So I'm the MAT manager at Kamal Medical Center. Kamal Medical Center is the tribe's healthcare center. Kamal means good medicine in Hoopa. And so the MAT is the program that gets clients off of opioids and onto medications like Suboxone. We have 63 clients. We have actually the biggest rural clientele, tribal native clientele in California. We do a lot of cultural resilience things like basket making and elk horn carving. Last week we smoked salmon. We had a big smokehouse built. So we try to build in cultural resilience for our clients. We offer massage and acupuncture. So we try to find innovative ways to help our clients connect to sobriety and then help support them so that they don't go have relapses. And so I manage that program. It's a really good program. And we've had in our little area here, we only have 3,000 people population on our reservation. And in 3 years, we had 28 overdose deaths. So CDC has come in and done a lot of studies and research and stuff. And we are like at, I don't know, 60% higher than anywhere else in California for overdose deaths per population. So our program is pretty important here, saving lives and trying to help connect people, getting them off the opioids and onto medication-assisted treatment.
That's really, really important work to be doing. Before we extend out to everyone else, can you just tell us a bit about why you were interested in getting this story out there in the news? I know you have some of a background in fiction writing and such, so why did this feel like it was the avenue for this story?
I felt like, Justin, because we're so good friends, saw, me in my very depths of despair, and it was a story we wanted to get out. It wasn't like journalists looking in and being objective, reporting on a story. It was my life that I was living every day. And I say, like, I've never done more than smoke weed as a teenager, yet I have lost my whole family to substance abuse. And I wanted to get that out because I feel like there's this stigma that follows people, even for myself, and I don't do drugs. I'm always getting, oh, there's Judy and her bad kids, or always getting beat up in my little community about it. And I wanted people to have empathy and see the real story of these children and families that are being torn apart over fentanyl. I mean, basically, it's fentanyl that is taking this from everybody. And it's just a really wicked drug that is really hard to get people off of once they're doing it. And so we just felt like there was the story to be told that people needed to see more in depth of the pain that it's causing and the hardship and heartbreak that people, not just my family, but a lot of families are living with every single day. And so that was what was important to us to get the story out.
Absolutely. And hearing it from your perspective, I think brings the reader so much more immersively into the story. And Alexandra, I know this first person narrative differs a bit from traditional journalism. So could you share with us why the New York Times team was intrigued by the story and what stood out to you that made you feel like this was the right piece?
Absolutely. So when I got to see the first sort of written draft of what Judy wanted to share with readers, I was just so impressed by her sort of candor and rawness and what she was willing to share with people. And it really felt like this piece had the opportunity to really change how people view the addiction crisis in the United States. The first person was interesting because, as Judy mentioned, it wasn't, you know, um, a layer of somebody else telling someone else's story. It was you were hearing from her directly. And because she is a part of this unique community that was interesting, at the same time, there's nothing more universal than a mother's love for their children or a grandmother's love for their grandchildren. And that, I think, is sort of something that unifies a lot of people who have been touched by addiction. And so it felt both like a unique perspective to share with readers, and yet also something so familiar, unfortunately, to so many people in the United States. And so it felt like her voice and sort of the despair that she was sharing, coupled with the incredible photos, was really a powerful way to get this message out of the grief that so many families are experiencing.
Absolutely. And I know the opinion section in general tends to work with journalists or writers who have that personal stake in the issues they cover, and there's such a unique power to hearing from that voice. How do you think hearing that can also reframe some of the narratives that we're seeing around issues like addiction?
Yeah, I think it's great that on opinion we do a lot of first person, because it can sort of cut through any kind of preconceived notion that people might have about addiction or who's affected by it. And it really helps to be able to show, these are real people. This is who they are. This is, the photos really show like their humanity outside of their addiction. And hopefully I don't know how you read that and you don't feel incredibly moved. And hopefully that, helps people think differently, maybe about their own opinions on the addiction crisis and what's happening.
And Justin, I know that you've worked in the context of recovery for many years. And so what are some of your experiences that you think journalism's limitations are when covering the issue? And how can journalists and photographers work a bit differently to challenge some of these common narratives that we tend to see from folks around addiction?
Yeah, I mean, I think the first thing that comes to mind in terms of limitations center around budget cuts. I remember my first assignment, it was 2008 for Mother Jones magazine, and I was still in college and I got 14 days to work on a story. They gave me, I shot film, and nowadays photographers are lucky to get a day or two or three at most, right? And what that does is it creates this a hyper pressured kind of situation where the photographer is looking, to satisfy the requirements of the assignment. And what are the easiest images to capture right around addiction? What's like in plain sight, like people using, you go to, if you work in San Francisco, you walk down the street, right? The easiest thing to see are people homeless, like sort of reductions of the image of the issue, right? And I think that obviously that lends itself to kind of perpetuating those notions and those narratives that sort of further isolate the user, right? And I think addressing isolation is an important part of challenging just the way in which that is represented. I think there's a journalist named Johan Harty, and he mentions that the opposite of addiction is not sobriety, it's connection. And so I think that in the way in which that we as an American, whether it's in the media or within prison industrial complex, right, we tend to there's a punitive approach to
May have also lost Justin to connection.
Really? You lost me?
Now we can hear you. Kind of sounded like you were taking a really long pause.
Oh, okay. Sorry about that. What was the last thing I said?
I think just mentioning the opposite of addiction is not sobriety, isolation instead. And then I think we lost you right after that.
Yeah. So I think the images that we see, right, needle in the arm, right, what they are is they're photographs of actions. And, you know, it's very easy to associate a choice with an action, right? And so when we see someone using, we're like, oh, that person chose to use, right? And then there's blame and shame. But we're not asking the larger questions of what are the conditions that lead people to using, right? And I think at the end of the day, publications are trying to sell copies and subscriptions, right? And I think if there's something that an audience like wants to see and that will drive traffic, they're most likely going to provide that for their audience, right? And I think as a journalist, like you have to be committed to your working methods and not sacrifice your ethics to satisfy an editor's need, right? And I think that photographers operate within a scarcity mentality because, like, if you say no to an editor, like, and what they want, like, you might not ever get hired again, right? And it's happened to me before. I don't want to get into specifics, but there was an assignment that I worked on for a mainstream publication around the issue. I told the editor I wasn't going to photograph drug use. And over the course of the assignment, it was actually a many-month assignment. The editor asked me a number of times, and I was kind of clear and told my reasoning behind it. And the story ended up getting killed for I'm not sure why, but in the end, the editor never responded to my emails again, and I was never hired from that publication. So, and there are consequences for having that sort of moral approach to your practice. But I think that's why it's important for people who have a connection to the issue, right? Who have some lived experience, like, I'm in recovery. This is very personal to me. Because to me, it's like addressing the issue is far more important than who I work for. So
Yeah, absolutely. But it's tough to navigate. Jackie, on the editorial side of things, how do you as an editor work to help protect the journalists who are interested in doing the quality reporting? And what responsibility do you see photographers having when covering some of these issues?
Sure. I mean, I think part of why I was so interested in Justin and Judy's piece was because of their, expertise and lived experience. And that's something that we feature in Opinion every day. Our guest essays, cover the most important topics of our time and also tell stories that would otherwise go untold. And I loved this story because of the care and empathy and trust that Judy and Justin had between each other. And I also knew that we would have a lot of time. We would take a lot of time with with both the text and taking of the pictures. So you saw so many of those pictures and how Justin was there for the big and small moments, the everyday, and that was really important, I think, for the subject matter. Many of our photo essays humanize the headlines. This is a headline that we all see, the drug crisis, but it was really a way to help readers understand something like Alexandra was saying that is so universal, unfortunately, where it's wonderful, the mother's care, but the crisis in the US is common. And when thinking about running sensitive imagery, there's a lot of thought that goes into that. We want to show our readers and also our subjects presenting these stories with empathy and respect and making sure that the images that we are running, if they are sensitive, are they adding a significant value for our readers? Thinking about our subconscious of unconscious bias, would we publish an equivalent photograph if we were closer to the victim, or if it was taken in your community, which Justin talked about a little bit last week. And of course, does it respect the dignity of the people pictured? And so again, coming into this, knowing Justin and Judy's rapport, their comfort, their trust, and Justin's so wonderful at crafting narratives and really taking the time. we didn't have a deadline for this story, I feel like the readers were really led into a world and could better understand Judy and her family.
Definitely. And Alexandra, I want to open this question up to you, but okay, if you don't have anything more to add, just thinking about what role storytellers and the media has in general in addressing the opioid crisis.
Yeah, I think the media in general has a huge role. It's one of the biggest issues that's facing this country and facing individuals' lives, and doing it with care and really taking the time to understand the issue and the nuances, and giving the people who are affected by it most the opportunity to tell their story and their perspective on it, I think is so critical. And one of the reasons why I just personally have enjoyed covering, enjoyed might be a bad term, but I've found covering this issue on the New York Times opinion desk to be quite fulfilling, because we have the opportunity to allow people to be very forceful with their actual views of what's going on, and really say, like, this is what's happening to me. This is, what the issues are. This perspective, in my view, is incorrect because of, XYZ, because of my personal experience. And really, that, I think, clarity of voice is very helpful in understanding an issue like addiction.
Absolutely. Judy, so I'm curious to bring it back to you here and here. What have been some of your personal experiences with the way that media portrayal has influenced your community's understanding of addiction? And what different positions do people in your community tend to take, and how are you navigating all of that? I know you alluded to it a little bit, but I'm curious to hear.
So, when the story came out, the day it came out, I started getting like the time difference messages at 5 a.m. And the first few hours, I felt sick. I thought, oh my God, what have I done? My daughter called me all scared, like, oh my God, Mom, what have you done? And, because I didn't know how not just my community, but the world was going to take the view and the story. And I I have I'm pretty gun shy. Like I have been, like I've lost my grandkids. Like I have been told I'm an enabler. You make addicts in your family because you can't set boundaries. Like I tried to do everything right to steer my kids away from addiction, and still out of my 4 kids, two still have addiction. And so a lot of people really do want to blame, and they want to be real punitive. So I was extremely scared that morning, and I felt sick. And I have to tell you that I have got nothing but positive, like from all over the world, from France and New Zealand and Spain and Canada, and people just sending the most thoughtful. Some people are experiencing within their own family. Some people had addiction. I think one of the nicest ones was a man in Missouri who emailed and said, I'm only here today because there was somebody in my life like you who cared about me when I couldn't care about myself. So everything I got back was so positive, so caring, so supportive. And it kind of helped lift me a lot that I'm not in this alone. I felt so alone and isolated for a lot of years, since 2014 probably. And to get so much support from the story has been wonderful. To get the view of so many people who are living it has been great. I think in my own community, which is usually the harshest, I maybe heard one negative thing, but otherwise I've had like really open support, and everybody coming forward with their story. Like I'm a people person. I love to hear what other people are going through or support them however I can. And all of a sudden I've really been flooded with, everybody's personal stories too. And I feel really honored that they even bring it forward to me because I know how hard that is to do. And I wasn't easy to find. It's not like you put my email on the story. Like people looked up my job and then got the directory to find the email to actually send. There's a really like a guy in the Middle East that works for New York and is a journalist, and his came way later, but it was so nice too about just everything that he got out of this story. So I thought it was so awesome to hear from journalists who are very well known in the world. So it opened a lot of doors and really took me out of my own isolated world here. Um, and felt support from so many people all over. So, yeah, it's been great. It's been a great ride.
Well, that's the beauty of storytelling, is that interconnectedness that it draws between communities from all over the world, and really amazing to see how it's worked in this context. I think this story is a great example of a positive media portrayal that really contributes to solutions and understanding around these issues. So I'm going to open this up to anyone, but I'm curious to hear what types of media representation we're thinking would be beneficial in addressing the substance abuse crisis moving forward. What can help contribute to some of those solutions and the work that we are seeing communities doing on the ground?
Yeah, I think photographers, right, need to look at the solutions, right, rather than the problem. And I think the solutions are oftentimes not in plain sight, or they're not in the headlines, but they happen in the everyday of folks on the front lines, right? Like activists, healthcare providers, social workers. I think those images are really important in reframing in terms of action-oriented, solution-oriented processes. There's a photographer named Jackie Dives who I wanted to shout out. And she's been working really hard to destigmatize the issue and photographing, documenting activists and healthcare workers in Vancouver for many years. Yeah, I think what the issue needs is the everyday, right? We talked about, we said the word everyday many, many, many times, right? A solution that Judy was providing is every day giving care to her kids, right? To her grandkids, providing love and support, right? On an everyday basis, right? Which goes against this idea of tough love. And I think Judy, you should talk about that, because I think that's an important context as it relates to an Indigenous perspective. But yeah, I think people are on the ground every day working to change drug policies and fill in the gaps of care, right? And I think journalists also need to be committed to that every day, right? Looking at images that aren't necessarily, sexy or that will win them awards, but that to me is like that's responding to the issue in a responsible manner, and I think that's what's needed. So.
Anyone else want to add on to that? I have more questions, but just want to take a second here.
I'll just say I very much agree, and I also think that what Justin mentioned earlier, I think the quote that the opposite of addiction is not sobriety, it's connection. I think, is that right? I think good. I just feel just feels so true, and if more journalists and reporters can sort of understand that and really explore that angle of it, like what are some of the drivers? It might not be what people expect. And I just think there's, with such an immense drug crisis, that understanding that aspect of it is so crucial.
I actually want to jump to this question that just came in the chat before we move on. For Justin in particular, audience member asked that considering that using is such a big part of addiction, could excluding it from your work risk removing a large part of a person's experience? Or similarly, do you think it could risk creating a divide between sympathetic subjects and users and what they see in their own communities? So I was curious if you just could elaborate a little bit on like where that benefit lies, you think?
Yeah, most certainly. I think it's a great question. I think that we have seen those images so many times, right? So, you know, if we read an article that's about addiction, right, we can place that in our mind, right? It's been frozen as a common narrative, right? So I think that personally we don't need that. And maybe during the first initial 2018 when the opioid crisis you know, was just blowing up, right? I think at that point, you know, maybe there needed to be some like, oh, this is a real issue. This is affecting people in the real way. But I think not every single publication had to do the same story, right? And that's what ended up happening, is that every publication wanted to have those images. Not everyone, but I mean, I would say that a huge majority of them. Yeah, and I think that in my own work, like, I've been working on a project in my hometown. Like I grew up in Hoopa, but I also grew up in Eureka. And Eureka is notorious for substance abuse, and there's a lot of vitriol like projected at people, like the addicts in Eureka. And essentially, what ends up happening is that people will place blame on disrupted environments, right? So like a stigma not only adheres to people, it also adheres to a place, right? And so people will come upon a disrupted environment in Eureka and they will just place it without context, right? They'll just place it on the addict. Oh, the addict did this. Like I call blaming on the addict. So I basically been photographing Eureka, removing people completely from the images and allowing like people's own prejudices to kind of fill in the gaps, right? Which I think is, to me, an approach that can kind of question our own internal processing, right, around the issue. And I think that's really important when addressing stigma, right? Is how do we all internalize this and then project our own opinions through how we interpret the things we see, or as a photographer, how you photograph those things too, right? I don't know if that answered your question, but yeah.
Yeah, and I put on the screen here just a couple of those photos from your project. I want to go into more of the work that you've done, but first I want to take a second. I feel like I've heard from a lot of people this theme of blame and people looking for a place to place their blame because it helps them rationalize the issue. So I think we're finding most of the blame is in these systems and in the lack of support for addicts. So Judy, I was wondering, could you tell us a little bit about, I know you've mentioned your work that you're doing, but what are you seeing that is working really productively within the context of the crisis and helping people move through recovery? And how are you seeing that work? Like, actually, I'm going to start there. I have a follow-up question, but we're going to start with that.
So I feel like, you know, what we found work besides along with the medication, I tell my crew here that the first thing we have to do is connect. People need to feel cared about. And even if they don't want help right at that moment, when they are ready, they come and find us. Sometimes we go downtown and we just hand food out and feed people. We are expanding our outreach. Our success has really been on a very aggressive outreach. We go to people, we meet them where they're at. We don't sit in our office waiting for people to come look for us. And last weekend, we had another fatal overdose of one of our tribal members who was in San Francisco. He had gone to treatment, and he's a young man, and his older brother, 2 years older, passed away a year ago from an overdose. So the grandmother who's raised them is, you know, very heartbroken. And we have, you know, maybe 8 to 10 tribal member community people now living 7 hours away on the street in San Francisco. So our team is going to go once a month now. We've just now been planning it, where we'll stay overnight and we really believe in the unconditional, not the punitive type of care and resources given. So we are going to go down taking food cards, blankets, socks, and hopefully we can grab up however many want to go to treatment. Detox, it's all in the detox at this point. People coming off fentanyl hurt really bad. It's like they say, I would rather die than go through that pain. I do believe the medical field is dialing in better at how they detox people. Before, they were not being aggressive enough and were treating fentanyl like heroin, but fentanyl's 50 times stronger. So the treatment they need to offer for detox and rehab needs to be 50 times more too, because people have had a really hard time getting off, even if they've only been on a little while. It's that strong. So I feel like just our unconditional, non-judgmental, aggressive outreach is what has made our program be really successful. Does that answer?
Yes, very much so. And I know in past conversations, you've talked about this idea of like unconditional support and how tough love isn't necessarily effective within Indigenous communities. Could you talk about how like that intergenerational?
Yeah. So, one thing I put in the story, and there was a word limit, was my whole life since I've had children, my biggest fear has been losing my children. I had an aunt who lost all of her children to suicide in a horrible car wreck. I have an uncle who lost his only children, both of his sons, to suicide. So we don't take for granted that people are invincible or that they're young and they can manage through things. We lose people at such high rates. I've never taken my children for granted that I could not lose them. When I wrote Reservation High in 2015, my son Roger was shot point blank in the temple and in the chest, and he was medevaced out. It was a nightmare, the worst day of my life. He survived. He doesn't have permanent damages, but then 4 weeks later, my daughter was stabbed 3 times. My only daughter, my baby, in a domestic violence. The boyfriend was on drugs and it was a domestic violence thing. And so in a short month, I had almost lost both of my children. I am not willing to chance the tough love. I'm not willing to turn on my children and tell them, pull yourself up and I'm cutting you off till you do. Most Indigenous families I know here are not going to do that. We've lost too many people that we are not going to be. The tough love is never going to work here. And our children and our young adults are already so hard on themselves. There's nowhere to go lower but death, and we're not going to take them there. So I really feel like in our environment and stuff, our culture, our community, it's going to be, it's the unconditional, kind, we love you, caring environment that gets people well. And I can't speak for everybody, but only for my community. But I know the tough love punitive here doesn't work.
Yeah, and that's why it's so important to be having members of the community so actively involved in the storytelling process, because only you can tell us what will work within your communities, and those solutions may be effective elsewhere too. I'm noticing we have about 10 minutes left, so I just want to take a second to say, if you have questions for our panelists, please feel free to put them in the Q&A chat box at the bottom. Before we run out of time here, Justin, I know you mentioned your project in your hometown, but I'm also curious to hear how you're taking some of these principles and putting them into practice within your work yourself.
Yeah, certainly. And we've talked about care, connection, mentorship. That's a huge part of the way in which that I've been approaching my work around the issue, which also comes from my own lived experience. A lot of my work that I've been doing comes from my own lived experience, right? So When I was struggling with substance abuse, I was addicted to heroin when I was a teenager. I met a man who was a healthcare provider, and he became my mentor. His name's Rosendo Medina, and he eventually became my adoptive father. But what he did is he helped me kind of see my own inherent value that I wasn't recognizing at the time, and then helped me reconsider the value that I held within my community, right? So value and purpose are two things that I think are an essential part of moving through the recovery process, right? I mean, you think about being a productive member of society, right? Value and purpose are inherently entwined, right? So he was showing me my inherent value, and then therefore I could find my own purpose in that process, right? So what I did using his methodology is that I created this alternative school that basically works with folks in recovery. We started in Eureka, and we've since moved to other locations. I've been doing a long-term residency in Cincinnati, and then also in Santa Fe. Basically, the basic premise is that folks in recovery, right, have these inherent skill sets that have never been valued by a larger society, right? Usually the substance user is on the lowest end of the social hierarchy, right? And so we have them go through this process of thinking about what their inherent skills are. And then they're in the project for usually 2 years. And then they develop that skill, they formalize it in different whether it's telling a story through the photographic medium, videos. And then once they truly, and also they create lesson plans, right, for where other people can learn their skills, right? And then once that's all been formalized, then we do these public events where people can present their skills, they can teach their skills in a public context, they can, share their stories. So it's an integration of different art practices. I mean, it comes from my background in socially engaged art, which essentially, I mean, I mentioned this in the first panel discussion, but it's an art movement that challenges who can be an artist, what art is, and where it's seen, right? So essentially, I'm giving folks the opportunity to like be experts, right? So it challenges this idea of expert voice. So they become experts in their own experience, right? So I'm trying to uplift lived experience to the status of expert knowledge. And it's been really, really effective. There's people that I'm still in contact with, or not in the project, that are sober, that are looking to get into the job market. There's someone that I know that's moved to Portland or Seattle, and he's going to school. And so people in the project become mentors for future groups. So, we've had like 3 or 4 groups that have gone through the project. So, I mean, that's to me is a responsive approach to the issue. So yeah.
Yeah, amazing. Thank you for sharing that. And we might not have time to go through all of these because I have a couple more audience questions, but just wanted to
Well, the next images, these are the images that the one to go over.
But yeah, go for it. Or one
Oh,
more.
I was just saying, yeah, this is images from, I don't know if you showed these.
I hadn't yet.
Okay. Yeah, this is images from the Field Guide project. So
Perfect. I will leave those on the screen. I was a couple slides behind you. I want to open it up to our New York Times editors for a second. We have a couple of questions from the audience. Thinking about how, if you have any advice on finding sources for covering these kind of stories, and what you've observed is essential in building trust and building that connection with local communities, so that the stories are portraying their experiences accurately.
Sure, I can,
Thank
I can
you.
start. I think it's always important to try to engage with people who are either directly affected or are working with people in addiction. Ideally people who maybe are trying these various harm reduction efforts and are really on the ground in their communities, working with people in person, one-on-one, and have that experience and really have a good nuanced view on it. So I really do think, like, as much as you can find people who have first person experience, I think the better. There's, of course, lots of, academics and researchers who can, be sources, but I do really think talking to people directly affected is very important. And sometimes, maybe those people can help you find someone, but starting there is crucial, I think.
Yeah, and Alexandra's done such a wonderful job with our coverage around this topic from both people who have the lived experience and also experts. On the photography end, I often tell photographers to not bring their camera and almost pre-report, get to know people, make a lot of phone calls even before you then meet the community or people and have your camera with you. So a lot of the work, and I mean, Justin knows this well, is really engaging with the community and leaving the camera at home, doing your research, becoming an expert on the subject or the place that you're interested in covering. And of course, if you have a deadline that's the next day, I understand that's difficult, but with this long form storytelling, I think it's important for photographers to forget about the camera at first and really read a lot and talk to as many people as you can.
Yeah, and I know that's something that Justin and Judy had even mentioned throughout their process of being able to say, no, I'm not comfortable right now, put the camera down, and really just like opening that line of communication. And of course, that is something that is easier with time. But Justin and Judy, do you want to speak at all about how your personal relationship helped, bridge that gap that sometimes journalists and sources have in trust because you two know each other so personally?
I mean, it definitely helped because there was times when I would get frustrated with Justin and just say like, oh my gosh, that, and he'd be like, okay, I don't want this to. So our relationship helped a lot, and that, we're close enough that if something happened or a court thing came down that day where, we could get a little bit of coverage, but then he knew when I was at my breaking point too, when I wasn't going to be able to handle anymore because I was, it wasn't just a story, it was my life. And he knew to respect those boundaries. He knew when I couldn't take anymore. And I think that is based so much on us just being close. And so with somebody else, it would have been harder. And when we actually met, he was doing a story on palliative care that covered me and my husband. It was also very sensitive subject. Luckily, we just really clicked well in even that story. He just took really great pictures that were really thoughtful. And now that I've lost my husband, the pictures mean everything to me. So,
Yeah. I mean, I can just reiterate that I was following Judy's lead. I mean, like I mentioned, I love Judy, and I just wanted to make sure that this process was only going to help her, not harm her, right? So I think that was at the forefront of my mind, was only wanted this to be in service to her and her family. So
Absolutely. And I think that care shines through in the photos and in the writing. Unfortunately, we're nearing the end of our time here, but I just want to thank you all so much. It's really great to hear from you and just learn more about this really incredible project. I'm going to share a link in the chat here if you're curious in diving into the story a bit more. We have an additional landing page that has extra photos, home videos, some audio testimonials. Our team put it together. It's really wonderful, really immerses you in the project. So I would definitely encourage you to check that out as well. And then, as I mentioned, definitely if you're interested, especially about hearing more about building trust with communities and that collaborative form of storytelling, take a look at last week's session that we had with Justin and Judy and Jackie. Thank you so much again for joining us. And if you are able, we would appreciate if you stay just a minute after this webinar ends. A survey will pop up on your screen, or you can use this QR code. And we would appreciate any feedback about how we can make our events more accessible for broad audiences. So thank you for joining us, and thank you again to our panelists. I hope you all have a good rest of your day.
thank you.
Bye.
Bye.